Hello everyone. Again, thank you so much for joining us for this brand new webinar hosted by Prevention Plus Wellness, located in beautiful St. Augustine, Florida. I'm Dr. Chudley Wirtz, CEO and founder at PPW, that's Prevention Plus Wellness. Today's topic, as you can see, youth opioid. Actually, I can't see because there's too much stuff. Youth opioid use, primary prevention and wellness. So this is a brand new webinar. And we've got actually hundreds of people that have registered. Hopefully we'll have lots of people hop online for this. So lots of slides, lots of information. As usual, everyone will get an email from me, if not this afternoon, tomorrow at the latest, with a link so that you can go to our website and you can have access to these slides. And that's important because a lot of the slides have links to further information. So you can look at those and you can share those with your colleagues in your region or state. And so you'll get the slides, you'll get a link to the recorded webinar, and you'll get a 1-hour CEU certificate for today's participation. So you get all of that. You don't have to ask for it. You'll hear back from me today or tomorrow at the latest. So let's go ahead and take a look at what the key objectives are for today's presentation. So you will be able to, number one, explore strategies for the primary prevention of opioid misuse and overdose among youth, as well as how schools across the United States are doing with regard to preventing opioid misuse. So there's actually a couple different sets of information there with that first objective. Secondly, we're going to review opioid settlement funding opportunities for you throughout the United States, and for you specifically in your state, in your locality. We'll be giving information on that so that you can prevent opioid use disorder and overdose among youth. And this is where I think participation is important, because we, all of us don't have the same amount of information. We all have different information. So sharing is really important. You know, I don't have all the information in this. This is all different per state. So it's going to be really, really important for you to share your understanding and knowledge of what's going on in your locality, your state, under the opioid settlement funding. Thirdly and lastly, we're going to discuss evidence-based opioid misuse prevention programs that target wellness promoting for adolescents, young adults, and parents. And that's, of course, what we're going to be talking about, prevention plus wellness programs. So, primary prevention of opioid use. This is where we're going to start. We've got a good number of people on right now. Before we launch into any further content, however, I want to share with you a very brief introductory poll. And so there it is. I've launched it. It's coming your way. 3 questions, very simple. I think 2 of them are multiple choice. You can answer more than one answer. One is just a single session, but you may need to scroll down just to remind you to see all 3 questions. So as soon as you get these, please answer them. It literally takes a moment of your time, and we'd love to hear from you so that we can get a sense of who's on, so we can tailor some of the content and the discussion and understand a little bit better about who's online today. So answer these 3 questions, very brief, scroll down, and then as soon as everyone's had a chance to do that, we'll go ahead. I'll send those results to you. We'll talk about them briefly, and we'll go back to the slides. By the way, at the end of today's session, we will have time, or we will take time, so that if you have questions or comments that you haven't already shared with us during the slide presentation, you'll be able to do that at the end of the slide presentation. Use the Q&A for that. The Q&A, just go to your toolbar, those 3 dots, I think, at least for my toolbar, and then you find Q&A, and you can drop in your question or your comment. And that's, instead of the chat, let's use the Q&A for any questions or comments. So we've got 3 questions. Scroll down, make sure you can see all 3 of them. And let's see, currently we're at like 64%. So we'd love to have at least 70% of you participate if you can. Well, that's actually, I apologize. We already have 76% of you participating. So let me just wait another 30 seconds in case you're in the middle of that. And you get to finish your participation answering all 3 questions. We're already up to 77%, so tremendous amount of participation today. So you guys are awesome. Thank you so much. And we're up to 80%. Woohoo! And thank you for participating. So I'm going to end the poll now, and I'm going to share the results. They're coming your way. They may just take a minute. And so let's take a look at the results of this quick 3-question poll. Question 1. Are you or your organization currently providing opioid misuse prevention for youth? And the majority of you said yes. 64% said yes. And then it looks like 17% said no. But we need to offer. But we offer substance use prevention. That's good. And then another, let's see, 11% also said no, they don't. And another 11% said no, but they want to. They want to. So the vast majority of you are providing, if not opioid prevention programs for youth, other substance use prevention programs, or you want to provide opioid programs. Number 2, is your state or locality currently providing opioid misuse prevention funding? And yes, 69% said yes. So I think maybe some of you want to share your expertise with that today. You'll have a couple of opportunities to do that. And then 23% said they don't know. So they're here to find out a little bit more. We will give you lots of information on the funding aspect. And then I'm sure you'll get some feedback as well from your colleagues that are visiting online today. And lastly, 3rd question is, are you looking for or interested in evidence-based opioid and other substance use prevention programs? 79%, almost 80% said yes, you are. That's awesome, because we do provide some at Prevention Plus Wellness. We provide opioid-specific and other substance use, marijuana, alcohol, e-cigarette, evidence-based prevention plus wellness programs. And another 15% said maybe you are looking for that. So thank you so much for participating in that poll. It was wonderful to hear from you. And now back to the slides. Primary prevention of opioid use. I've got different content here, different information I pulled together for you. Some of this already know, preaching to the choir, if you will. But I mean, it doesn't hurt to have a little review of some of this. And for some of you, this will be new. So opioid use primary prevention. What is it? So this is where adolescents are exposed to opioids. That is a significant concern for both A, acute opioid overdose, and B, future risk of opioid use disorder or misuse. So what is primary prevention? It focuses on preventing the development of opioid use disorder, and I would say opioid overdose deaths. So that's what we really are trying to prevent: overdoses and overdose deaths, obviously, as well as misuse of opioids, including opioid use disorder. And so preventing exposure to opioids is a part of opioid use primary prevention, as well as increasing the protective factors known to reduce the risk of opioid use disorder. And I said increasing, I should say, protective factors, and decreasing risk factors for opioid use, misuse. What are some strategic approaches for opioid youth opioid overdose prevention in schools? So, by the way, here's one of those slides where you'll see at the bottom of the slide, or within the slide, you'll see a link. This is the source of the information. This was the state of opioid overdose and response 2025. So this is a new citation. You'll be able to look into it and read more on your own, or share it with your colleagues. So the role of schools is to educate students and parents about opioid use prevention, and some cases also naloxone ensuring naloxone access if in case of having an overdose in your school setting. At a minimum, this source says this information says it's essential to include substance use prevention education. At a minimum, substance use prevention education is what you all do. That's why it's so important. That's why I so much enjoy interacting with you and hearing from you and learning from you and sharing with you. So it includes specific information on opioid and fentanyl use, but also how to recognize signs of overdose and even how to use to be an active a bystander and help if someone is having an overdose. The recommendation from this source of information was for us as prevention specialists to partner with health departments and the parent-teacher associations. I'm sure many of you already do that to gather information on what parents want and need with regard to helping avoid opioid misuse and overdose among youth. Schools play an essential role, of course, to opioid prevention. In fact, there's rankings of states and as how well schools do in this regard. So schools have the opportunity to address opioid overdose risk at the earliest moment. So that's why it's so essential. As you all know, as prevention specialists, for those that you are here, you know prevention is so essential because once that misuse begins, whether it's frequent use or heavy use or it's an addiction, it is so hard to turn that around. Treatment is so difficult. Recovery is so challenging. So that's why prevention, that's why what you all do is so very important. So in schools, the strategy is to include providing opioid use prevention, both to students as well as to families, ensuring naloxone is accessible in spaces where it's high risk for overdose, and equipping parents with resources. So youth, parents, and even naloxone. Those are the three things I see the most of in terms of opioid prevention. So these are 4 school indicators of how well schools are doing with regard to their opioid use prevention. And so we're going to look at the results of these across the nation on a state-by-state basis. So one indicator is the percentage of youth reporting that they did not receive drug or alcohol education in the past year. A second indicator is the percentage of schools reporting that they taught the difference between proper and abusive over-the-counter and prescription medication use. Thirdly, the percentage of schools reporting that they provide parents and families with health information about drug and alcohol prevention. And lastly, fourth, percentage of youth reporting that they have talked with a parent or caregiver about the dangers of alcohol, tobacco, or drugs. So let's take a look at what we know on a state-by-state basis. We know that there are top and bottom rankings with regard to states. The top 10 states ranked based on the schools addressing opioid prevention these are the states doing the best with regard to opioid prevention. You can see it under the first bullet: New Jersey, Utah, Connecticut, Massachusetts, Montana, Arkansas, Maryland, New Hampshire, Kentucky, and West Virginia. So if you're from those states, congratulations. Give yourself a round of applause. Good for you. And then these are the bottom states. It's not like this is your fault, so don't take it too harshly, but it does indicate that here's the highest need states with regard to opioid use prevention, according to these state data. And here it is. The bottom states are Arizona, Hawaii, South Carolina, Mississippi, Tennessee, Kansas, North Carolina, California, Louisiana, and Michigan. So there's room for improvement across all states, but those bottom states, especially with regard to those 4 indicators. And let's take a look, drill down a little bit more on those 4 indicators. So the one indicator was youth reporting that they didn't receive alcohol drug education. And believe it or not, almost 4 in 10 students report they didn't receive any alcohol or drug education, of course, in the past year. Of course, that could be there's some error in those data. Maybe they don't remember. But then again, not everybody responded. So this is an estimate, almost 4 in 10, which is really way too high a number. So there's room for us to improve to reach kids in schools with regard to alcohol and drug prevention education. The CDC and the National Health Education Standards both recognize alcohol, drug education and prevention is a core topic in the health curriculum. And drug education should include how to recognize the signs of an overdose and administer naloxone. So that's what you want to see also in your opioid prevention curriculum. How about schools? U.S. schools, opioid prevention statistics, a couple more statistics here. About 80% or 8 in 10 of all schools in a CDC's school health profiles, and by the way, not everybody participated in the school health profile, so there is some gaps there, but those that did, 80% of the schools said they taught the difference between the proper use and abuse of over-the-counter and prescription medication. Secondly, fewer than half of schools provided parents and families with information about drug and alcohol prevention. So definitely there's a need for some of our good work in the area of reaching parents and families. And also similarly, number 3, about half of youth in the U.S. reported to have talked to a parent or caregiver about the dangers of alcohol, tobacco, drug use. So there's some room for improvement for what we do, and I know you're working very hard on it, and we'll continue to work hard on it. How about investing in prevention? These sources that I'm presenting to you with these links identify the importance of investing in prevention. States and localities should be making a long-term investment in effective programs. And of course, we all know those in the prevention field that, the bulk of the money, it's just, I guess, a human fault that we don't think in terms of prevention. We think in terms of, crises and dealing with things as they happen. So the majority of any funding, including, which we'll talk about soon, the opioid settlement funds, are going to go, as you would guess, to treatment and recovery and related things. Some of it will trickle down to the most important of things, all things prevention. And so that's what this is. This source is saying state and localities need to invest in long-term effective prevention programs, and that substance use generally, and opioid misuse in particular, must be a part of that investment for youth primary prevention. And in fact, the return on investment is very good. For every dollar spent in prevention, $18 is saved. And so again, it pays to prevent substance use. And of course, I know I'm speaking to the choir, but well worth sharing this information with others. Again, a couple other points to mention in terms of investing in prevention. Nearly 8,000 adolescents ages 15 to 19 died of opioid overdose between 1999 and 2016, and approximately 1/2 of all people with substance use disorders start their substance use before age 14. So we do want to, push back or postpone that initial use. And then again, of course, we want to also prevent the development of heavy use and regular use, which is associated more with harm and addiction. So this is a good source on the topic of prevention and intervention as a public health strategy. So this information, this document talked about the need for targeted interventions for adolescents with substance use problems, including opioid and non-opioid drugs, cannabis, alcohol, etc. And that all substance use prevention is critical to preventing the onset of opioid use disorder. So it's all related. I mean, you can pull it apart if you want, but also the big picture is it is integrated, it's associated. So preventing one type of substance use can help prevent other types of substance use, to take that to another level, promoting healthy lifestyle behaviors can also help prevent substance use. So this, the author of this document cited 3 types of prevention and intervention that can have a public health impact. Number 1 was universal screening of substance use, like SBIRT, screening, brief intervention, referral to treatment. By the way, for those of you that don't know, prevention plus wellness programs, most of our single session programs include a script to present them as an SBIRT. The advantage of PPW SBIRTs is that you also have the content to provide for all youth, providing this SBIRT evidence-based prevention. So prevention plus wellness programs are SBIRT with evidence-based prevention integrated within them. So this source identified number 1 prevention intervention strategy, universal screening for substance use. Number 2, they identified secondary prevention strategies among youth at risk for developing substance use disorders. And I loved, under this bullet here on the second part of the slide, I loved the detail of identifying risk. I thought it was really well done, very comprehensive. Look, I highlighted some of it, but all of it is really good. You want to look at this more closely, perhaps. I know you know a lot of this, but well worth restating. Kids at risk include those with traumatic events and other adverse childhood experiences, mental health comorbidities, a prior personal history of substance use, family history of substance use disorder, low caregiver monitoring, affiliating with peers who use substances, and living in communities with easy access to substances. All of those put youth at a higher risk for substance use disorder, and those are the kids that should be in particular targeted for secondary prevention. So you've got screening, universal screening, including SBIRT. You've got targeting higher risk kids. And then thirdly, this is where we all come in, I think, universal prevention strategies are essential to promote healthy choices and behaviors, physical activity, nutrition, sleep, stress control, as all PPW programs do. That's prevention plus wellness programs. And so really the importance of integrating and having broad content with our universal prevention programs, prevent substance use and improve healthy lifestyle behaviors. That's the whole package. That's the whole health positive strategy. And so the source, and there's the link at the bottom of this, is NIH, the document states that it's essential to have evidence-based prevention and early intervention curriculums, whatever they might be. Could be prevention plus wellness, could be others. And then engage caregivers as well. Don't forget the parents. And we see we need a lot of work in there. And by the way, PPW programs, we do have parent programs, by the way. So I'm going to pause at this point. Now is one of 2 opportunities for you to participate. If you have something to share, now is the time to do it. Go to your chat space and let us know what you think about this question, what you suggest. What help or resources do you most need to provide your youth with opioid misuse prevention in your region? What do you need? What resources do you need? What help do you need so that you can provide youth with opioid misuse prevention in your region? Go to chat space. I'm going to pull my chat space up right now and see who's answering that question and see what comments we might get. Now's the time. Funding, evidence-based programs. I see evidence-based programs, great information. Somebody says funding, updated and accurate data on statistics around opioids. Thank you for that, Lee. More evidence-based curriculum. Check out, if you haven't already, preventionpluswellness.com. Preventionpluswellness.com. At least take a look at what we have to offer. Let's see. Funding, better, also more funding. Lots of funding there. Better access to our school system. That's really important. Hazel said that's a challenge as well. Thank you for bringing that up. Mentors in schools, identifying people to, and by the way, we're talking about in one aspect, I guess, youth leadership training so that we can have positive mentors and positive role models in our schools. Agreed with evidence-based curriculum. So you can take a look at those great comments. Thank you so much for participating. Thank you for sharing what you need. And go ahead and keep sharing if you want to. Now, while you're doing that, we're going to shift to opioid settlement funding for prevention. So I'm going to give you a chance to share what you know in this area too at the end of this section. So what are the opioid abatement settlements? Just so that we're on the same page, this is the legal settlements with opioid manufacturers, distributors, retailers, and the idea is to remediate some of the harm caused by the opioid crisis through prevention, treatment, and recovery. But as I said, we're already seeing the majority of that money going to treatment and recovery, definitely needed. Eventually, some of this is going to trickle down to prevention. I wish we had 80% prevention, but it's not the case. But nonetheless, there is money's going to prevention, and there will be over the next 15 or 18 years or whatever is remaining. So look for that, get involved in that, and that's what we're talking about right now. Each state has developed their own process for distribution of these opioid settlement funds. And the good news is that nonprofits, and I'm assuming many of you are affiliated with nonprofits, will be able to access and get some of your fine services and evidence-based programs funded, so that you'll be eligible to apply for these grants in many states, if not most states, maybe all states, hopefully all states. So here's one thing that you need to be familiar with if you're not already: the National Opioid Settlement, a list of opioid remediation uses, Schedule A, core strategies. So one part of this core strategy I wanted to highlight for you as prevention specialists is G, prevention programs. Two things I wanted to highlight there. Number one, funding for media campaigns. So if you want to do media campaigns, if you want to grab a regular campaign that's already available, like Real Cost, you can use that. Interesting thing about media campaigns, not strong evidence of their effectiveness, particularly in influencing youth behavior. Sometimes there's some change in reaching awareness, certainly. Sometimes knowledge changes, not a lot in the behavioral change area. So that's why number two is available: funding for evidence-based prevention programs in schools. So look for that. That will be available, or should be available in your state, or that's available right now. And here's another part of that National Opioid Settlement Exhibit E list of opioid remediation uses. This is Schedule A, core strategies. I found this, I was sort of surprised by this. There's a section B, which is for medication-assisted treatment, MAT, distribution, and other opioid-related treatment. But under number two, under MAT, is provide education to school-based and youth-focused programs that discourage or prevent misuse. So even within the MAT section, medicated-assisted treatment, there is a line of focus on a need for school and youth-focused prevention, misuse prevention. And lastly, one more related of this Exhibit E that I wanted to show you is a list of opioid remediation. Schedule B, approved uses, and this is part two, prevention, misuse opioids. A couple of things I wanted to highlight there is number one, funding for media campaigns, mentioned that already. Number five, I cut the rest out because we didn't have space for it and it wasn't that relevant. But number five, funding community anti-drug coalitions that engage in drug prevention efforts. That's probably you and your coalitions, your local regional coalitions. And then number six, supporting community coalitions in implementing evidence informed prevention. And so there's a little more content there. You may want to read that: staffing, education, campaigns, etc., including evidence-based programs like Prevention Plus Wellness. So there it is. It's in the Exhibit E, the National Opioid Settlement. That's why you will be seeing these states should be seeing them providing funding for prevention. It's right there in the National Settlement. So how to apply for funding for prevention? I recommend going to the guides for community advocates on the opioid settlements. It's called Guides, and there's the link under number one. This website provides state-by-state drop-down menu to access each state's comprehensive guide on opioid settlement funding. There's a link under number one. You can go to that. Now, one of the things in that drop-down I wanted to highlight is there's a section on grant funding. Really take a look at this one, because this is the one that has information usually on whether the state is funding opioid prevention. And then number three, look for youth prevention funding priorities, application timelines, funding scope, which can range from local to county to statewide. Under this guides for community advocates on opioid settlement, check out the grant funding section. And then there's also usually a section on updates, quote unquote updates. So sometimes they'll have a section there where you could sign up for email updates. Do that so that you get that information and make sure you stay updated on what the state is providing to localities and nonprofits for opioid and other drug prevention. So, how to prepare a winning a proposal? So you see that there's some funding available. How to get that funding? You have to submit a proposal. Most cases. So, according to this document, points should be considered based on previous successful opioid prevention grants in 4 areas. Don't forget these 4 areas. Number one, evidence-based approaches. Use prevention plus wellness. Use life skills training. Use whatever, but pick something that has evidence. And now some states will have an evidence-based list. They created their own, and they'll say go to Blueprints for Healthy Youth Development or whatever the case may be. Sometime not. But we have plenty of evidence of our programs being effective. We have published research. We're on evidence-based registries for alcohol, for marijuana, for opioid prevention, et cetera. So prevention plus wellness is one of those evidence-based approaches. So you would do well to use that. And on our website, we have plenty of information about our programs, including logic model, research, registries, sample proposals, et cetera. So check out preventionpluswellness.com resources, and you'll see what we have to offer. So don't forget Prevention Plus Wellness. We're the only opioid and other substance use prevention programs that target healthy lifestyle behaviors associated with physical and mental well-being, which is so critical to today's youth. Number two, this site suggested, in addition to targeting evidence-based approaches in your grant writing, partnerships is important. So look to partner with other organizations and agencies. I know you already do that. Just a little word again about Prevention Plus Wellness. We have a parent prevention program. It has 4 lessons in it, 4 one session lessons you can present to parents and caregivers. One dealing with opioids, but another alcohol, marijuana, and e-cigarettes. So that's a good way to partner with parents using the Parent Prevention Plus Wellness program. And remember, they focus on the health behaviors, so it's positive, and youth will be open to hearing those messages. Older youth, they've heard prevention messages, will tune it out. But if you focus on healthy future images and healthy behaviors like PPW programs do, they'll be much more likely to tune into those kinds of communications. At least that's our experience and the experience of our providers throughout the country. This one is focus on objectives, focus on outcomes, focus on evaluation. The good news is Prevention Plus Wellness programs come with built-in pre-post surveys, electronic online surveys. You could assess outcomes, you can monitor outcomes, as well as program quality and fidelity. And lastly, in addition to those 3 things, the last thing, sustainability beyond the grant. So providers, these funding agencies will want you to show how your program will extend beyond the funding. So what we see with the opioid programs is is our providers of the country will say, well, we've got 2 years for funding from this state or local opioid settlement grant, but we'd like to continue our program for 3 years or 5 years. You can do that by buying the materials and continuing that process, or you can buy a license. So if you have a 2-year grant, you can buy a 3-year license or a 5-year license. So you can continue to provide training and provide program materials well beyond the time frame of the funding. And that is really an important point to highlight in your grants. It highlights sustainability. Don't forget, our programs are, for the most part, very brief. Most of them are just a single session, screening, brief intervention. You could implement them as ESPER, you can implement them as universal prevention in groups, and you could reach all youth. So that public health influence, really important to mention in a grant. State opioid settlement funding tracker. If you are not aware of this, you need to be aware. There's the link at the bottom of this slide. There's over 50 billion now awarded to the states and localities on opioid-related lawsuits. States are working on identifying priorities as we speak. Different states have different, time frames on this. They are investing in substance use development, prevention, treatment, and recovery, as I mentioned. This tracker offers you a snapshot of which state has announced awards from the settlement funding or published priorities. So each state's different. They've set up their own decision-making and spending process. Many of you, I'm sure, are well aware of that in your state. There's a good place to go. It's called the State Opioid Settlement Funding Tracker. And then this is also very useful. This is called the Opioid Settlement Tracker. So the first one I said was the State Opioid Settlement Funding Tracker, but this is an opioid settlement tracker. And this has highlighted the fact that the latest awards for opioid settlements now total $57.1 billion. That's a lot of money. And hopefully we'll get some of those resources for the essential work that you provide to youth and young adults in your communities for opioid and other drug prevention. So Christine Minhee, who's an attorney consultant in this area, set this up. So thanks to her, this opioid settlement tracker. Under number 3, there's 5 sections I want you to be aware of. This tracker identifies global settlement tracker, expenditure reports. Number 3, this is really important for all of you, community grants, 4 state level guides, and 5 archives. So that number 3, that section on community grants section includes funding opportunities with upcoming deadlines. So this is a really great source. And there's the link at the bottom of this slide. If you haven't seen this resource, Opioid Settlement Tracker, it's a great resource. Lastly, one more resource, Opioid Settlement, Principles, Resource, and Indicators by Johns Hopkins University. And these are just identifications of indicators that can be used to monitor the impact of your opioid settlement fund programs. And you could build these within your grant applications. So some examples are, number 1, eligible number of children or youth who will receive early intervention services. Number 2, schools who implement evidence-based prevention programs. 3, youth who are exposed to evidence-based prevention. And number 5, students who are screened for substance use disorder. So those are just some indicators. We've talked about that already. And that's a source from Johns Hopkins University. Let's pause one more time and get your feedback in the chat space. Tell us a little bit. I know this is, you can mention a lot of things, but maybe just very briefly, what funding that you're aware of does your state or locality offer for providing youth opioid misuse prevention? So what funds does your state or locality currently provide, or maybe is going to provide, for youth opioid misuse prevention? Let's see some responses to that. Click on the chat space. Let's see. SOR, Cody says, which means what? Oh, substance, that's What is that again, Cody? It's blocking at that. A state opioid response funding. Yes, thank you for that, Cody. Grants, but a lot more. Somebody was saying grants, but a lot more of their attention is going towards cannabis prevention. That's sort of interesting. Well, again, all of it is important. All substance use prevention, by the way, put a plug in. Prevention Plus Wellness has cannabis prevention programs, as well as opioid and alcohol and e-cigarettes. Let's see, anybody else saying anything about this? State opioid response, Cody had said her. Well, I know that we get a lot from SAMHSA, but that's not, we're really talking about the funding that's coming specifically from the opioid settlement funds. So I'm glad you're on this webinar. I'm glad you're going to get these slides because I want you to check these resources and these opioid settlement trackers because you may learn something from this. Jim says we receive opioid settlement funds from San Diego County to implement Project Alert. Thank you for that, Jim. And Donna says, don't know at this point. And Jean says, our county received a share. So remember, this money is going to be released for years. So you want to go to these trackers, you want to get on their email list, you want to keep your eye on this. Every state is different and what percentage of the funding goes to the states versus the localities, and how the funding will go to nonprofits. Become aware of that if you aren't already. What year does the settlement sunset? Well, I think it began a couple of years ago. So I think, as I understand it, Jim, it's like a 20-year process. So don't hold me to that. In every state may be a little bit different, but nationally, I think it's a 20-year process. So we're talking about years of funding of opioid for opioid treatment, recovery, and prevention. And of course, we're all about prevention here. Let's shift gears now to wellness promoting behaviors in opioid. This may seem a little odd to you, but I want to highlight 4 healthy behaviors that have been shown to be linked as protective factors for youth opioid use. So, for example, physical activity. Adolescents who participate in sports and exercise are less likely to report using prescription opioids non-medically. Now, it is true under number 2 that youth athletes are at higher risk for exposure to prescription opioids if they get injured and have a severe injury. But the research shows under number 3 that adolescents who reported engaging in sports, athletics, and exercise were less likely to have ever used opioids for non-medical reasons. So you got some data supporting physical activity as a protective factor. Nutrition is a protective factor. Nutrition is essential. Brain development for children and adolescents is important, and mental health problems and substance use in children and adolescents may originate from unhealthy diet-related behaviors. So diet-related behaviors, breakfast, fruits and vegetable consumption, very, very important to young people. And opioid misuse prevention. Same with, passed over sleep. Don't forget sleep. Youth sleep problems are associated with a higher risk for prescription opioid misuse. So, for example, insufficient sleep increased the rates of both lifetime and past 30-day prescription opioid misuse. So, just a couple of studies I pulled up to show you the linkage between these health behaviors, physical activity, breakfast and nutrition, sleep, and stress control and opioid misuse. So this study here looked at adolescents who were assessed for substance use disorder treatment, and they asked them, why did you start substance use? And they said seeking to feel mellow, stress-related motivations, and so interventions related to reducing stress and addressing mental health concerns might reduce the leading motivations for substance use among adolescents. So that takes us to the opioid prevention plus wellness resources that we provide. We have an opioid PPW program for adolescents, single session program implemented to individuals, if you want to, as an escort or brief one-on-one intervention, or to groups as universal or secondary prevention. If you want to, the unique aspect of the opioid prevention plus wellness program is that again, it does target physical activity, breakfast, nutrition, sleep, stress control. So it's a whole health, a brief screening and brief intervention, motivational intervention designed to prevent opioid use and to increase protective healthy behaviors. And it's based on the evidence-based InShape prevention plus wellness program. Opioid PPW, again, targets those health habits, and it's based on a behavior image model, which says you can use desired future images of young people. What do they look like in the future? Set goals for them to motivate their behavior, and that is highly motivational and will initiate that behavior change process. What does the opioid prevention plus wellness for adolescent program look like? Here's a couple of slides. They first complete a wellness behavior screening survey to think about their health habits. I'll show you what those include. And that increases, again, reflection and awareness of their health behaviors. And then the feedback. Again, this can be done one-on-one or it could be done in groups of youth. It can even be done virtually as well. We have online programs. So most days of the week, do you engage in moderate physical activity for at least 30 minutes? For example, fast walking, slow biking, etc. So that's the first question that's on that screening survey. And here's the first part of that feedback. 30 minutes, moderate physical activity. What are the benefits? Feel more energetic. So we do target and try to cue those image terms like energetic. Sleep better is another benefit. Look more fit, another image term. What are some other things? Enhanced mental well-being, self-esteem, confidence, anxiety reduction, reduces stress, lets you work harder and smarter. All very important, positive outcomes and benefits of that particular health behavior, which is moderate physical activity. And now a discussion to reflect on their own health. We continually want to bring this back to their own behaviors, their own lifestyles. What types of moderate physical activity do you do, or would you like to try to do more of? And then you can have a brief discussion in your group or with that one individual youth. And now linking how non-medical opioid use interferes with creating a physically active lifestyle. It causes drowsiness, mental fog, nausea, constipation, reduces energy. I mean, literally, if you're sick or you're feeling out of it, you're not going to be able to exercise and participate in physical activity. Exercise causes sleepiness, dizziness, hurts your physical performance. All very important. That's how we link multiple behaviors in prevention plus wellness programs. And then the other behaviors that are discussed in the survey and then provided in the feedback that you present on the slide-driven presentation are vigorous exercise for 20 minutes or more, like basketball, running, swimming laps, everyday diet, being a nutrient-dense diet. That may be a term that some youth are not familiar with, but they'll get familiar with it. Whole grain fruits, breads and cereals, pasta, lean fish, poultry, lean meats, dark vegetables, red vegetables, citrus, other fruits. So that's, nutrient-dense foods. We're going to talk about that. Then you're going to be talking about the importance of 8 or more hours of sleep, critical to overall health, mental health, and preventing opioid and other substance use most days of the week. To use stress control techniques. And so being physically active, eating nutritiously, getting sleep, all stress control, but there are other strategies, relaxing in nature, progressive muscle relaxation, meditation, Tai Chi, yoga, deep breathing. So you can introduce young people to these things. And then lastly, in the last 30 days, have you used any prescription opioids, Oxycontin, Vitamin, codeine, and so forth. So those are the questions. So those are the reflection items on the health behaviors. A couple other slides to show you what else is covered in this content of the opioid PPW program. It describes what misusing prescription opioids means: taking too much of the drug, using someone else's, taking it for a longer time, taking it for different ways or reasons than to get high. And then also, what is it? What is an overdose? What does it look like? What do you do? And so that information is also included in the Opioid Prevention Plus Wellness program. Lastly, recommendations for increasing overall wellness: physical activity, nutrition, sleep, stress control, avoiding non-medical opioid use, other illegal opioid use, as well as other substance misuse, and then completing the goal plan to initiate that behavior change process. So that's the Opioid Prevention Plus Wellness program for adolescents. We also have an opioid and, stimulant program for young adults, very similar, but for 18 to 25 or so. And you could actually use this for older adults as well, but this is very similar. Single session program, motivational screening, brief intervention. We have a parent PPW training, opioid prevention. So this is very unique. We took the evidence-based youth programs and put them in a format so that parents can be taught within a single session how to motivate their youth to both avoid substance use and increase their protective healthy behaviors, how to do goal setting at home. And so this is a one session program, but there's 4 of them within this program. You could have the presentation to the parents that focuses on opioids or e-cigarettes or marijuana or alcohol, and you can even integrate those. So that's the parent PPW training program, and you're introducing parents to the 5-step prevention plus wellness parent model for motivating youth to engage in to improve multiple health behaviors. And here's just some of the slides from one of our parent training. This one is, the topic is opioid prevention, but again, there's actually 4 presentations. Again, another one addresses alcohol, and one on marijuana, one e-cigarettes. So there's the session objectives for this presentation to the parents and to the caregivers. It's just a single session. You can have it as brief or as long as you want. And you can see the critical content that's described. And you're going to talk about common healthy behavior problems among youth, the benefits of healthy behaviors, physical activity, nutrition, sleep, stress control, relationship between healthy behaviors and substance use and mental health. And then lastly, you're going to talk to the parents about strategies for promoting healthy lifestyle behaviors. Lastly, we do have media campaigns for each of these substance use topics. And our programs are evidence-based registries from SAMHSA, documents to blueprints to, you can see, there's just a few of them. So lastly, PPW advantages for opioid use prevention. Very easy to implement. They can be tailored to fit your county's drug prevention needs. We can work with you on that, and also to plan to evaluate your program's outcomes, provided to all youth, so you can have a true public health research. You even can implement them not just in classrooms and one-on-one, but also on-demand virtually. And we have these 1 to 5 year unlimited program training licenses. In conclusion, providing youth opioid use disorder and overdose prevention is critical as the first line of defense against addiction for youth. I wish we were getting more funding, but do keep an eye out. Use these trackers to find out what funding is coming down from this opioid settlement to your state and localities and to your organization, so you can expand the work that you need to do, continue to do for providing and preventing opioid and other substance use disorders for youth in your area. Remember, prevention plus wellness programs have some real advantages by having whole health interventions in a very brief format, so you can reach all youth. And there's some more information. So I'm going to stop at this point. If you want to download our fact sheet, if you want to look at our 2-minute video, there it is. I'm going to send all this information to you today or tomorrow, no later than tomorrow. If you have any questions, let's go now to the Q&A and see if anybody has any questions or comments. If you have a final comment, we've got a couple more minutes, 3 minutes. I'm happy to stay longer if you want. Any final recommendations or suggestions? I know everybody is at different levels here with regard to awareness of these opioid abatement settlement funds, but do your due diligence, learn about what's going on. If you haven't seen this, you will see these funding, and do get out there and ask for it. And in fact, I would say demand it, because we need to have more of these funds go into prevention, primary prevention. We want to stop, the opioid use disorder. We want to stop the overdose at the beginning rather than later on. We definitely need funding for treatment and recovery, absolutely, but we do need more funding and more work in the prevention area. That's where my heart's at. That's where I believe we need to be focused on, and I think many of you feel the same way. Let me see if there are any comments or questions in the chat space. Are there? I see somebody's asking questions in the chat space. I'd rather have you asking the Q&A because I might miss it if it's in the chat space. Excellent. Where do we go from here? So again, like I said, you'll be hearing from me. I'll send you an email today or tomorrow. Actually, I have a doctor's appointment, so I may not get it out today, but I'll try. And you'll get a link from me, and you'll have access to the slides and the recording of this webinar and a CEU certificate for your time today. Anyone need to study how to speak Arabic? Okay, are there, that's a good question, are there anyone need to study? Okay, thank you guys for being here. God bless you for all you do with youth and families in your region. If we can help at Prevention Plus Wellness, let us know. Go check out Prevention Plus Wellness resources. We got free resources for you. And do check out our opioid and other evidence-based programs for youth and for parents. I think you'll find them to be very practical and a positive approach. Thank you, appreciate it. Thank you very much. Thank you guys. You're the ones doing the heavy lifting, the important work, and I'd love to work with all of you. Let's make it happen. If we can help in some way, if we can support you in some way. By the way, we'll have another webinar in 2 weeks from now, same date, same time, same day. And then I think another one after that in 2 weeks. So we got another 2 or 3 more webinars before the end of the year. So executive presentation today. That I think you probably meant excellent. Thank you, Harry. I appreciate that very much. I'm going to check one more time if anybody had a comment in the. Yes, they do. We do have a Q&A. So we see anonymous. Did PPW used to go by another name? I don't see it in our registry of evidence-based and EI programs in PA. Well, we did. That's a good question. We may not be listed in your registry. We're listed in. I did a presentation, I think 2 weeks ago, on the good, the bad, and the ugly of evidence-based registries. Bottom line, you can, by the way, you can access it on our, go to our blogs, and you'll be able to see the slides and the previous recording. But the bottom line is it's a human endeavor, this process. So we're listed on, we're listed anywhere from model programs to promising programs to not listed at all. We're listed in some of the most challenging and rigorous registries like Blueprints for Healthy Youth Development or the California list or others. We're not listed in others. So we may or may not be listed, but you can make a good case for us being evidence-based because we have the research, published research. We are listed in other evidence-based registries. And whether or not we're listed in your state registry really depends on the process and what they use to come up with that list. So again, there's good and bad to those registries, but certainly, number one, we're evidence-based because there's published evidence of our outcomes, both preventing substance use and promoting healthy behaviors. And number two, we're listed on these evidence-based registries. Number three, we use an evidence-based practices screening and brief intervention format. Evidence-based practice, which is above evidence-based programs. So we use a screening and brief intervention practice like expert related, and that is an evidence-based practice. So you can make a good case for our programs being evidence-based at different levels. Somebody says, Nicholas says, any recommended authors, books, or other literature that encourages sports prevention for youth? Get these slides, Nicholas, and then click on the links and you'll have plenty of information. And do check out our website, preventionpluswellness.com, and look at our resources. So thanks for that question. Another anonymous is, how do you find sources to apply for grants? Well, that's a whole other topic. So I would just say you could start with resources in the opioid settlement money with the links on the slides that we're presenting today. And then you could also just search online. You can do searches online for funding for drug prevention in whatever state you're in. That's one quick answer to that. That's the best I can do at the moment. Donna says, are there resources for those who may not have funding to cover the cost of training? Well, I don't know. I mean, there's foundations, there's different resources. That all comes back to the funding that was raised. So look for your state funding, Donna. You should have some eventually. Keep an eye out for that. Sign up for the emails on that and continue searching. And I'll just tell you from our perspective, we work with our nonprofits to get materials so that they can implement, and if they have within their budget. So we're flexible. We're a small family business, and so we'll work with you to get something, to do something in your area. So let us know what you need and what you want to try and what your budget looks like if you have any, and so on. All right, that's it. I got to go. Time's up. You guys have been awesome. I appreciate it. Keep up the good work. Thanks for joining us. Have a good day. And check out our website, preventionpluswellness.com. And see you hopefully in another couple of weeks for another webinar. Bye, everyone.